Our next speaker this afternoon is the Southern New South Wales Board Chair, Dr. Allan Hawke, who was appointed to this position in August of last year. Dr. Hawke has deep roots in the region, having been schooled in Queanbeyan prior to gaining a Bachelor of Science and a PhD at the ANU. Allan has extensive experience as a senior public servant and diplomat and is a fellow at the Institute of Company Directors, a fellow of the Institute of Public Administration Australia, and a fellow of the Institute of Managers and Leaders. He is the current chairman of the Canberra Raiders. I won't share my thoughts there, otherwise it may be a career-limiting move. The director of the Lockheed Martin Australia and a member of the Committee for Economic Development of Australia and the Board of Governors. Please welcome Dr. Allan Hawke.
Well, thanks very much. In fact, although I was appointed in August last year, my first board meeting was in September, which also coincided with the annual public meeting in Goulburn. So that was my initiation to the fire of being the chair and my introduction to my fellow board members at the time. In fact, I might just pause there and ask all of the board members to stand up. So you can see them around here. Ken and Beth here, Jeff Frost over there, Jeff Kettle, Russell Fitzpatrick, you all know him. Russell Snyder over there, you may know him from Eurobadalla. And we have our famous doctor from Cooma, who the Triple C talked about yesterday. So thank you very much. If you want to get into their ears afterwards, feel free to do so. So as you mentioned, I was actually born at Royal Canberra Hospital, and I saw the light 3 days later and moved to the centre of the universe, which would be better known to most of you as Queanbeyan. I spent 32 years full-time in the public sector, and then since 2006 I've been in both the public and private sectors in all sorts of different roles. Over the time of my career I developed what's called a results through people leadership philosophy. And I have this fundamental belief that you can't get the results side of the equation right unless you get the people side right. So that started when I became the chair. We didn't have a chief executive officer. So then three of us got together to go through the candidates for the position, to interview them, and then finally to appoint Andrew Newton. Lots of people will tell you that one person can't make a difference, but that's not actually true. One person can make an amazing difference no matter what field of endeavour they're in, and it'd be fair to say that we think Andrew's made a real difference in the 9 months that he's been the Chief Executive Officer. He actually bought his car down here in Bega, and I think he told me that he's already clocked up 30,000 kilometres travelling around our local health district, talking with all the people there, talking with consumers, patients, people who have an interest, and also, of course, with our wonderful staff who work in each of our 12 facilities around the local health district. So in that vein, I should tell you that we got the results just recently of our latest People Matters survey. This is done annually, and we had some terrific results. These results offer insights in what needs to be done on the people side of the equation. I believe that three key factors underpin what a high-performing organisation should be, and they are commitment, trust and pride. And I have some measures against those that we'll be working towards. And underpinning those are a couple of other factors: job satisfaction, loyalty, respect and values adherence. And if you open that lovely little blue book in front of you, you will see there we've articulated the vision, the mission and the values of our local health district. Well, last year's survey told us that, this is the one before this one, less than half of the survey respondents were positive about the accountability and action being taken on the survey results. If that's not a wake-up call, I don't know what is. In response to that, we developed a district action plan focusing on three key areas: communication, workplace culture and performance. And that outcome, I think, is reflected somewhat in this year's survey. The overall response this year was 71%. That's 9% up on last year, when the number of respondents gave us an idea of how engaged they are. My target is 80%. If we can get 80% of our people to respond, then we know we're hearing from the majority of them whether they're happy or unhappy and what they think needs to be fixed. A couple of other pleasing results: a 6% rise in employee engagement, which reverses a downward trend from the last 4 years. And everybody knows that employee engagement is a great measure of the people in the organisation being able to give discretionary effort to the tasks that they're involved in. And that's why we put so much credence on that. Our workplace culture improved by 6%. Staff feel more valued, treated respectfully, while feeling more positive about sharing lessons learnt. And our sharing lessons learnt doesn't mean just within the facility where they work. I'll come to that in a minute. It means right across our local health district. Our district improved in terms of communication with senior managers, performance and development, and what I call renewal and leadership. The challenge now is for each of our executive team, which Andrew will introduce in a moment, and those people in each of our 12 local health facilities to develop and deliver an action plan to address the issues that staff have raised in their area. It's not what you say that matters, it's what you do that counts. So staff will do you the courtesy often of listening to what you say, but they take their lead from what you do. And so we're looking to turn the outcome of these results into concrete action on the ground. So I come now to this year's Quality Awards, where we had a celebratory lunch. These Quality Awards allowed our candidates to highlight the outstanding, innovative work of our staff while sharing in their success. I was struck by the quality and number of the nominations, the innovative ways that they are trying to deal with our patients, and the dedication of our staff to that end. We attracted 58 submissions from across the district, the highest number in recent years, clearly demonstrating the quality and breadth of work taking place across our LHD. They highlighted the dedication and creative thinking of our staff, working as individuals or in teams, often in their own time, to make a difference in the quality of care that we provide and deliver in our district. A number of the category winners then progressed through to the New South Wales Health Quality Awards finals to compete for state honours. Over the course of the last year and a bit, actually, I've given a number of presentations to our senior leadership team about leadership versus management. Nobody ever says they want to be managed more, but they're all looking for leadership. And there is a distinct difference between leadership and management. And the leader's job is to shape and share a vision that gives meaning to the work of others. That's what people are looking for in the workplace: meaning in their contribution, recognition for the work that they do. So our core values, which are in there, collaboration, openness, respect and empowerment. And we're also developing what we call a people first, a putting people first philosophy. And as I said to you earlier, we get that people side right, the results will follow. So I think there are 5 characteristics that distinguish exemplary leaders. I actually haven't mentioned this before, but they are: challenge. Does my immediate supervisor provide enough challenge for me to learn, to develop towards my potential? Elbow room. Does my leader give me enough room to do the job that I'm there to do, that they're not control freaks? They're not there looking over my shoulder the whole time. They're interested in me delivering the results that I'm required to do as an individual and as part of the team I work in. Acknowledgement. Does the supervisor acknowledge good work? Do they get the opportunity to talk to their supervisor about their development, about how they're going, about how they can improve towards their potential? Self-respect. I think people want to be respected for the role they play, and so self-respect is a quite a strong thing. It's not self-esteem, that's quite a different concept. And then there are people who want to be proud of the organisation they work for and the role they play in it. And what better thing can they do than to be helping people in need in our healthcare area? So we're looking to increase their pride in what they do and in our local health district. Yesterday afternoon, Andrew and I spent quite some time in here with the community consultative committees talking about how they engage with us to improve what we do and to try and get agreement about the terms of reference and how they'll go about that, to try and produce some commonality across the whole local health district about what's done in each of those areas. And they, of course, overlap with those 12 health facilities around our very big region. We're not far off, of course, having an election in New South Wales, and the caretaker period starts 3 weeks, 3 months, I think, before the New South Wales election, which is due in March. And in that period, the caretaker conventions say that the government can't make any significant policy decisions or enter into contracts. But our routine business of helping people in need in our healthcare facilities will continue unabated during that process. I do expect one result before the election's called, and that is confirmation from the government about who will remain on the board going forward, and I'm hoping that they will appoint another 1 or 2 members to the board, obviously to take up some areas where we don't think we're well represented at the moment, or where we can do better in some areas. And I see 1 or 2 people scattered around the room who might be wondering whether that meets their needs. I can say unreservedly that all of our board members are highly regarded in their respective fields, and they take an active role not only in the board's proceedings and the governance issues, but within their local communities to help us all do better at what we're there to do. Thank you for listening.
Thank you, Alan. It's very inspirational.